So today I'm going to go into my multiple questions database, and I actually like Nurselabs questions because they actually have quality rationales and explains why A is correct and B, C, and D are incorrect. So one thing that I do want to make note, remember that the NCLEX is all about putting out, if you will, competent nurses, right? And so when you don't pass your exam, there are usually some gaps within, I find out, within education, knowledge, and application, and also testing test anxiety, and really believing that you can accomplish your goal. So when we look at a testing strategies are approaches to a question that allows you to assess what you know, what you don't know, what you need to go study, and also that your critical thinking skills. How are you thinking critically regarding these questions? So let's go ahead and get to a question. You are assigned to provide nursing care for a patient receiving mechanical ventilation. Which action should you delegate to an experienced nursing assistant? So this question is asking, out of these actions, what should you delegate to an experienced nursing assistant? And remember, experienced or not, when we delegate, we're looking at the role, what's within their scope of practice, if you will, whoever they're asking about, LPN, nursing assistant, UAP, etc. So that's where I'm setting my mindset. My keywords are delegation, and we're talking specifically about a mechanical ventilation client. So A, do you assess the patient's vital respiratory status every 4 hours? Do you delegate that? Do you delegate that to an experienced nursing assistant? Or do you delegate taking vital signs and pulse oximetry readings every 4 hours? Or do you delegate checking the ventilator settings to make sure they are prescribed to an experienced nursing assistant? Or do you delegate observing whether the patient tube needs suctioning every 2 hours? So one of the things that I try to enforce with my clients is AEPT. A means assessment, E is evaluation, P is planning, whether it's planning an exercise routine or planning home care or nursing care plan, and T is teaching. Those tasks you want to keep with the RN, the registered nurse. So when I look at A, automatically when it says assess, I'm like, nope, can't do that, because the person needs to have enough experience to be able to know what to look for. B, taking vital signs and pulse oximetry readings every 4 hours. That looks good because we know that UAPs or nursing assistants can do vital signs and pulse oximetry. C, checking the ventilator settings to make sure they are prescribed. That's more of assessing, right? And then D, observing whether the patient's tube needs suctioning every 2 hours. Assessment, evaluation. And so I'm not going to pick A, C, or D. And often people say I can limit it down to 2. And when you limit it down to 2, you want to go back to your keywords, right? And see what exactly is it asking. Am I understanding the question properly? So again, you want to read that question, paraphrase it in your own words, because you know how you speak, you know how you talk, you communicate with your brain, and then pick out those keywords. What are we really getting to in this question? And then look at the options, know what your keywords mean, look at the options, and then look and see and make sure they're all clear, they're all true, and then go with your answer. And also state your rationale before you go to the question's rationale, because then you could see, am I coming in alignment? Is my thinking coming in alignment with what the rationale is saying? And so you can look at the rationale, and it basically says that nursing assistants have preparation for taking vital signs. Otherwise, all this other stuff should be done by people that are well educated, including the RN. Remember, just because it says experience is not meant to trick you, they really want you to think critically. Again, the NCLEX is not out to trick you.